Hi, my name is Brittany Vasquez, and today I'll be talking to you about mental health screenings in the military and improving the PHA or periodic health assessment process. So imagine you're a sailor in the United States Navy. It's supposed to be the world's greatest Navy, and you're expected to be resilient and tough, but you've been feeling a little off. You think that maybe this would be a good time to bring it up during your PHA or periodic health assessment. But when you're trying to schedule it, you find yourself doing a 25-page online questionnaire before you can even schedule an appointment. And then when you schedule an appointment, you're scheduled into a 25-minute time slot, and your provider's just checking the boxes and trying to rush you out of their office. This is not okay. While mental health is addressed in the PHA process, it's not addressed correctly. The mental health process needs to be mandatory, but it also should be done in depth and in person. According to a study done by the Walter Reed Army Institute of Research, which is a big military hospital, they surveyed 598 sailors before, during, and after deployment, and over 50% of those sailors screened positive for a risk of depression, and over 25% of them screened positive for major depressive disorder at any time. For me, it was one provider who really made a difference. During my PHA process, this provider sat down with me and asked me the hard questions. They took their time, went over their time slot, and really asked me how I was doing. There are a lot of reasons why sailors are not seeking help for their mental health. One being the lack of resources. The military is struggling to find providers in the civilian sector who are willing to switch over into the military side because they don't pay as well. Sailors are also unaware of the capabilities that the military does have. So there's a behavioral health clinic and Military OneSource, which do offer resources. However, due to the influx of patient care demands, it takes about 1.5 months on my base, Fort Sam Houston, to be seen in either one of these sectors. Another reason why sailors are not seeking help is they're not aware of the capabilities that general practitioners do have. So general practitioners, they do receive training for mental health, but because sailors don't know that, they assume that the practitioner doesn't know what's going on because they're not a psychologist or psychiatrist. Although they are not a mental health provider, they can help you with medications or therapy, or at least get you through the right channels. One of the last reasons why sailors aren't being seen is fear of separation. So we call it going to see the wizard, and if you go see the wizard, you're broken, and that's it. You can't deploy anymore, you can't advance anymore, and your career is basically over. Bye-bye to a 20-year pension, bye-bye to any hopes of doing anything in the military ever again, which is not true. I personally work hand in hand with military providers as a hospital corpsman, and even I was unaware of the capabilities that we have. So what do we need to do to fix this problem? One, we need to change the conversation. We need to change the culture with military and civilians and get used to talking about mental health. Mental health does not mean that you're broken or crazy. If you twisted your ankle, you would go see a provider. So why not take care of your mental health the same way that you take care of your physical body? In the process, us as patients, we need to learn to be honest with our providers, and we need to be honest with our realizations and expectations. This also is going to take the providers to take time. The appointment should be longer than 20 minutes. It should be 45 minutes at least to truly address mental health concerns and any other health concerns that you have during your periodic health assessment process. And we need to properly utilize screening tools like the Center for Epidemiologic Studies Depression Scale, which was used in that Walter Reed survey, And we need to take the PHA process seriously. This is not a check in the box, something that you need to get done. This is a time for you to address your mental health and physical health concerns. Things will not get better until we start taking it seriously and changing this conversation. Thank you.